Prevention of Nipah. First one, avoid direct contact with infected people. If you are in contact with infected one, definitely you have to wear personal protective equipments such as gowns, gloves, mask, googles, etc. in order to prevent the infection. Next one, wash hands regularly with soap and water. That will prevent the risk of infection by contact. Next one, boil freshly collected date palm juice before drinking. So while collecting fresh fruit items, observe that fruit items in order to check the bitten marks by birds or bats or animals. If you are seeing that, please throw it away. And there is a risk of infection because the bats are the highest risk of getting Nipah. Next one, avoid direct contact with body fluids because due to close contact with infected person, the Nipah can be transmitted. That's why we have to avoid the contact with the body fluids. Then wear N95 mask when at public places, working or staying or traveling. So rather than 3-layer mask, use N95 because that gives 99% protection. That's why we have to use N95. Then another important thing, avoid areas where bats are known to roost. Then avoid eating or drinking products that could be contaminated by bats, such as raw fruit that I already mentioned. Then avoid contact with the infected areas, or if you knew some areas are high risk, please don't go through it. Okay, then maintain social distancing. Don't go outside unnecessarily because there is a risk of infection by public. Okay, close contact may get the infection, or the transmission of infection may be higher while in contact. So, when you are going outside unnecessarily, there is risk of infection. So, please maintain social distancing. Then if you are getting this Nipah, there is no treatment, only the supportive measures will be there. So there is no adequate treatment. We are just managing the symptoms and giving protective measures to the person. So that's why preventing Nipah is more important than treating Nipah. Thank you.